three of us. This is really cool. Hey, everybody.
It is very kind.
It is
Hi,
very
guys.
cool. Hi, guys. How's it going tonight?
We're so glad you could join us.
So before we jump in, because we want to wait for a few people to get on, I'm going to share a tidbit about where Ariel lives. So Dr. Ariel lives in a town called Winona, Minnesota. And do you know the actress Winona Ryder? Mm-hmm. So she did a Super Bowl commercial, and it was in, do you guys remember this? Like it was, well, of course, Ariel probably, it was in front of the Winona, Minnesota sign, and she was building a website. It was like an ad for a website builder, but I always think that's so, like, it brought attention to Winona.
Oh, yes. It was a very big deal in Winona, leading up to, during, and after the Super Bowl.
Oh, I'm sure.
Very widely talked about.
That is so cool.
Yeah.
I love her in Stranger Things.
I know. That is probably one of my favorite Netflix series. Yes. I'm waiting for it to come back. Just waiting. I know. All those weird ones.
I haven't watched it.
Yeah. Oh, you're missing out.
If it was a book, she'd read it. No, you might not. You might not read that one.
I'm kind of a scaredy cat.
It can be kind of scary in a not a Stephen King scary way, but it's kind of scary. No,
it's like eerie, right? Like eerie.
Yeah. That's a good term. Kind of scary, eerie. Yeah.
Yeah, but not like gruesome, scary or anything.
True.
I'll think about it.
You think about it. All right. Well, I'm excited for tonight. We're going to have some great conversations. We're going to learn a lot from Dr. Ariel. We've been waiting for this interview. This has been our favorite one coming up, just because we have such great information that I know you're going to be sharing with others. Hi, Jenny. Looks like a few popping on, so that's awesome. So yeah, I'm excited. So thanks for joining us.
Thanks for having me.
You bet. So yeah. Should we get started? She's getting us started. See, this is when I know we officially start, is when we start moving around on the screen. So just business. It's kind of like, we'll keep kind of like, it's like a fair ride. It's kind of fun. So, well, I'm going to share a little bit first about my history with Ariel, because I love you so much. But I've known you for a long time, and you actually did some work with Daisy Blue early on. We actually collaborated on some products together.
Yeah.
And it was a really cool connection. You actually trained some of our consultants, and so that's the original connection to Daisy Blue in the business. But thinking about like what's going on now in the world and people talking about Elderberry and everything else going on, we just thought it would be a great time to have you come on and share your amazing expertise and knowledge. So let's get started. How about we start with, what is a naturopathic doctor? Like, take us down that path about how you got started and why.
Sure. It's a good question, especially in this area. I mean, I never heard the word naturopath till I was 21 years old. 18, actually. I don't know why I said 21. 18. So I was looking for a way to help people that was holistic. So that involved the mind, body, and the spirit. And I just felt like generally the conventional medical field left out the mind and the spirit. Psychiatry didn't include enough of the body. And so I was kind of like searching. And I couldn't find it anywhere. I was actually in public health at that time. And then I studied abroad in Australia, and they had a naturopathic program there. And I had never heard of it. And I was like, this is amazing. It's everything I've ever been looking for. I just never knew it existed. And at that time, there were 4 schools in the U.S. So I came back from that program, and I started gearing up to apply to that graduate program. So, it's a 4-year graduate degree. So I got my undergrad from Winona State. And then I ended up going to Portland, Oregon, to their naturopathic program there. And naturopathy can be a little bit confusing because the term is not regulated in every state the same. So, your friend Billy could study herbs over the weekend and put a sign out on his house that he's a naturopath. And that's not illegal, especially in the state of Minnesota. And that's not to say that people who use that term are not good quality healers or valuable, knowledgeable people. Just there's different levels of education. So my program is an accredited program, which is 4 years, similar to a conventional like medical doctor. So first 2 years are heavy basic sciences, clinical and physical diagnosis. So like how to listen to someone's heart, how to listen to someone's lungs, how to read your lab work. And in a multitude of states, I think 16 right now, we can prescribe pharmaceuticals and we're fully covered by insurance. So that just depends state to state. And in Minnesota, we're registered, and that means we, at this point in time, and that means that we can make diagnoses. I do lab work in my office, but I can't prescribe pharmaceuticals, which most of the time I'm okay with.
Right. It's one less thing that you have to dive into, the pharmaceutical side.
I mean, there's a handful of things I wish I could utilize, but I have a pretty big toolbox the way it is. So
yes, you do. And I think that's something too that a lot of people may not understand. I mean, you've had over 8 years of schooling, and you had to do clinicals, and you have your own business, and you can do blood draws, and you partner. And I just know all this because, I've been seeing you forever. You can do blood draws, and what I love about your profession is that you do look at the body as a whole instead of just one thing. You're looking at all the aspects of it. And instead of just saying, well, let's just run a test for a gamut of things, we're like, well, let's really dive in and see what is this level and what is this level. So I think it's a really, a lot of people don't understand that. So I think it's really cool that what you shared hopefully brings some light to a lot of people. I often think, when I was in college, I studied chemistry and I looked at pharmacy, and part of it was because I wanted to help people, but it was more the herbal side too.
Sure.
And you're right. Like there wasn't anything like this that I recall at that time.
Yeah, for sure.
Yeah. That's really cool. That's really cool. So tell us about your practice and like, what do you typically, what's your, what kind of patients do you like to see, or what's most of your referrals that come in?
Sure. So I have 2 offices, one in Elderberry and one in Winona. I'm in both of them 2 days a week. And I see a little bit of everything kind of at this point in time. I'm the only one of the few naturopaths in southern Minnesota, and there's really rare, very, very few in Iowa. So, I kind of reach that crowd too. And because in naturopathic medicine, we're all about restoring the body to health, a lot of times, even if I don't have experience in a particular diagnosis, if I get my patient, having better sleep, better gut function, better stress management, better diet, usually you can improve some aspect of quality of life. So I have a hard time turning away too many people because of that fact. But a lot of what I see is like women with fatigue and some thyroid stuff and some adrenal stuff and some hormone stuff. A lot of anemias, a little bit of chronic illness, I see a few kids here and there. It's all a big word.
And it kind of comes down to the gut and being healthy and.
Yes. In naturopathic medicine, the health of the gut is like the root cause of everything. And so really anyone comes to me for any complaint and I have to like restrain myself to be like, don't ask about their poop right away, Ariel. Just like give them a little bit of time. And for anybody who's ever worked with me, they've seen that I like to use, I even have it with me. I didn't plan this, but we'll just do it anyway. I have like my very favorite poop chart that I like to use, you know, because it's more fun than the adult version.
I love that you just happen to have a poop chart right next to you, you know?
Just right next to me. Yeah, like, you never know when you're going to need it.
Yep. I love it. Yep, because that's important. So I love it. I love it.
Tells you a lot about the health of your overall body.
Yes. So everyone tonight, make sure you watch your output. Watch your output.
Yeah, there's a joke amongst my profession that like naturopathic doctors don't like automatic flushing toilets because it doesn't give us enough time to examine our poop.
I've gotten very comfortable with talking about poop now. So, yeah. However, tonight we may talk about it. I don't know if there's a question that comes through. We'll see. So tonight, as you're joining us, feel free to ask Dr. Ariel any questions you may have. But we are going to get started maybe sharing about, especially with what's going on right now with the illnesses and everything else going on. What are some of your suggestions, or what do you recommend?
Sure. I always tell my patients for like any health problem across the board, there's kind of like a baseline thing that we need to be healthy. And that's going to all be a bunch of like common sense like stuff. And so a lot of what we're looking at right now, I think, is how do we make sure that our immune system is operating in the best shape that it can? Because, you know, we learn every day. We can get a little overwhelmed with, you know, how contagious is this virus, and, you know, are people without symptoms are still contagious, and then we start to get into like a pretty big, you know, a place of pretty decent fear, which turns out is not great for the immune system. Actually, every time we think a happy thought, our immune system gives a little boost. So that differential between living in a fear-based and having, you know, happy quality thoughts can have an impact. And then there's all the other stuff, you know, like sleeping. So getting our, you know, ideally 7 to 8 hours of sleep a night. That's really great for our immune system to regenerate during that time. There's interesting information out there about, I'm not sure how much of it is fully backed up, but there's a theory that maybe kids are a little less susceptible because they have higher levels of melatonin. And so, not to say that you should go out and start taking a bunch of melatonin. That's definitely not what I'm saying at all. But it just means that making sure that our melatonin is getting its ability to do its work in our body is important. And melatonin kicks on when the lights go down. So that's pretty tricky in this time when there's a lot of like binge watching Netflix or Amazon Prime or Hulu or you name it.
Right.
So typically melatonin kicks in when it starts to get dark out. And so that's important. It's important to start dimming your lights in the early evening and kind of getting your body ready for that. And then, of course, you have to have nutrition. So eating, you know, your vegetables and fruits, probably, you know, a little bit more vegetable, a little bit, you know, 2 to 1. I kind of like that idea. And sugar itself actually also lowers our immune system as well. So that's something to think about. You know, a lot of times my patients are like, oh, I'm getting sick, so I start chugging the OJ, like, which is great vitamin C, but pretty high sugar. So it's just something to think about in terms of, you know, what is the load of sugar in your diet?
Right.
And then one that I'm really stoked about, and I love thinking about it for myself, is that there's a lot of evidence that this virus really doesn't function well in heat. So there's multiple ways that you can heat up your body. I think saunas are amazing, and I wish that I had one in my backyard and I could just go out there right now and sweat it out. But I don't. And, obviously, if you have a health condition, you should, make sure that, heat is safe for you. But I use a lot of heat in the version of hot baths and hydrotherapy, which we could talk about if you wanted. I think that is the best thing ever. I promote it all the time in my practice. And then even exercising. So like exercising, you're internally heating up your body. And so I've been really digging that for myself lately. Like when I'm exercising, like, yes, I'm also preventing coronavirus. Like it just feels good on so many levels.
I love it. Right. That's a cool way to think about it. Instead of like, oh, I got to go run or go for a walk or exercise. It's like, yeah, baby, I'm doing my part.
Yeah. So even if it means that you're just like, putting on a few extra layers while you're walking. So you're getting a little bit more of an internal sweat. Yeah.
Very cool. So, all right. I do want to talk about hydrotherapy. And the reason is because I have used it. I love it. Actually, even last night and maybe it's because it's allergy season, or maybe just kind of what we talked about earlier before the call, just the heaviness and stress. I just feel off. My body feels off a little bit. I've had to change a lot of things, so nothing seems normal right now. So I took a very hot bath, drank hot tea, had my sea salts. It was you and another gal that I work with had recommended that. And then of course you always recommend the hydrotherapy, which I did. So share about that, because it's kind of a crazy thing, but it works.
Yes, it is crazy. So hydrotherapy, the premise of hydrotherapy is alternating hot and cold treatments. Short hot and short cold treatments, especially when you stack them on top of each other, stimulate blood flow. And when you think about our immune system, it's roaming around the bloodstream. And so a lot of times when we're stimulating that blood flow, we're making the immune system move around the body, and it's kind of like looking to do some work, right? Like, what do I got to do here? So if I'm sick, or my family members are sick, or my patients are sick, you can bet that one of my first recommendations is going to be hydrotherapy. And home hydrotherapy can be, you can explore. There's all kinds of options. My favorite at my house is to put a space heater in my bathroom and run a hot bath. I like to use Epsom salts, or if I'm lucky enough to have some Daisy Blue, hemp and copaiba, I like to use that too. And then I bring in a bucket of ice water with a couple of like cotton absorbable washcloths. I go into my hot bathtub. It's hot in there. I'm like, oh my gosh, I'm sweating. And once I'm good and hot, I take the cold washcloths. I put them, on my chest, on my back, maybe on my throat if I have a sore throat, maybe on my face if I'm congested. And you should feel some pulsating in the area. That's blood flow coming to the area, bringing healthy cells. And it also relieves a lot of that congestion. So a lot of times I do it before bed. However, not that long ago, I have this patient, and I love to give her lots of credit. If she's out there, she knows who she is. She was like, I didn't have time to be sick or ill, so I did the hydro bath twice a day. And I was like, oh, during the day? And so I tried one during the day. Turns out it's awesome because you feel so much better afterwards, which is, I think it's not surprising to any of us, really. Like, think about when your body is achy. How does a hot tub sound to you? Oh, that sounds fabulous. I like that, right? And when you're sick, you're having that same body achy thing. Yeah. I feel like whenever I've had a flu bug, like one time my husband and I had one at the same time, I felt like we were fighting over the bathtub, because it's just like a place where it really releases that tension on your muscles.
Yeah.
which is super important right now. And I want to say this for sure, because I think it's really good for people to know if they haven't already. It's a really great way to help support your immune system. Also, it's a great way to relieve some symptoms so you don't have to use an NSAID like Advil or ibuprofen, because those have been shown to, especially with COVID, make the disease worse. So if you have to use something, use acetaminophen or Tylenol. But if you could get away without it, that would probably
Hydrotherapy.
Hydrotherapy is even better.
Yes. Well, and then just one more thing on that, because if you don't have a bathtub, and I mean, I've taken baths, but sometimes I'll just do a really hot shower, and then almost every time before I get out, I always flip it over to cold. Yes. And just give myself a good cold rinse. Or like when my lower back was in a lot of pain, I always would make sure I did cold on my lower back. Yeah, and that was something too that always felt amazing. So I think, there's still, don't let the excuse of no bathtub stop you from doing it.
Agreed.
Yes. So, all right, I'm going to switch gears a little bit, and we're going to get into some questions here shortly, but I want to touch on elderberry, because we've had a lot of discussion around, in fact, we've been hearing a lot. We sell elderberry, and we hear a lot about, well, I heard I wasn't supposed to take it with this virus. So share your insight on that.
Yeah. So a lot of this confusion started from a study that was actually an in vitro study, which means it was like in a test tube, right? Not in the human body. And this study showed that elderberry had the ability to increase a particular cytokine. And so what is a cytokine? We should say a cytokine is, it's a part of our it's a messenger that's a part of our immune system. And in the beginning of any type of illness, having an activation of our immune system is important. And so in this study, it showed that it activated the cytokine, right? Which kind of extrapolated to this view that, oh, well, in COVID, we're seeing an overabundance of a cytokine reaction. And so it became this theory that elderberry could therefore cause a cytokine storm, which is a pretty big jump, especially considering there's multiple other studies that showed that elderberry can also decrease cytokine action. So this is a big thing about herbs as a whole, is that they are not like a pharmaceutical drug. So pharmaceutical drugs have one mechanism of action, right? You take one that we're commonly talking about a lot right now, an ACE inhibitor, which is a blood pressure medication, right? It has one job. It shuts off the ACE enzyme. That's it. That's what it does, right? Herbs aren't like that. They have multiple components within them that have medicinal actions. And so to kind of try to break them down as to having one mechanism of action just isn't really possible. Mm-hmm. And of course we can't, elderberry has not been studied in COVID-19, as have many, many, many other things because of where we are and the timing. But, as someone who studied herbs for a long time, to take that amount of information that I just shared with you and assume that it equates to it causing a cytokine storm seems pretty unlikely. Like the example I heard, I'm going to quote my mentor, that I heard from a talk that he did recently. He said it would be like, if elderberry can cause an increase in cytokines, that would be like the amount of dumping like this glass on something, right? Cytokine storm in COVID is like dumping like a swimming pool, right? So to think that this glass caused it is a little bit.
Right. So in other words, don't drink 500 gallons of elderberry in one day.
I mean, I don't think that the amount of elderberry that you take is going to cause a cytokine storm either. I mean, some of my other colleagues are saying, maybe that means that you want to take elderberry as a preventative, and maybe that means when you're sick you want to stop. And that's, I don't think there's anything wrong with that. And elderberry is just one herb. There are all different kinds of herbs that work to support the immune system, and all different kinds of nutraceuticals that support the immune system. And so that doesn't have to be the be all and end all. And in fact, it makes me a little bit nervous as a herbalist when I go to, purchase from my companies, and I'm like, oh, you can't even get it. Right. And something we have to be thoughtful about as plants as a whole. We always have to be thoughtful about how we use them. Right.
And I think that's what I'm seeing sometimes and hearing is, that either there's that fear-based, oh, I better stock up now just in case. And I like the idea of taking it more as a preventative, and and that's what most of us should have been doing anyway all winter. And at least that's my recommendation too. Like it helps. There's a benefit to it, but there's obviously so many other variables, and just like you talked about, it really is starting with just how you build your immunity. I mean, that sounds like the number one thing you can do.
It's big, right? If you think about a pyramid and that's your base, and if you don't have your base, like, pretty hard to count on this outside thing to rescue you,
For sure. All right. I love when you share. All right. I see one question from Krista Joy. If someone were to schedule a first appointment, what would a person expect? Is the process different for everyone? What do you go through?
Sure. So typical first appointment for me is an hour and a half. And we sit down, we start with goals and priorities. We talk about what you're hoping to accomplish in the short term and the long term. And then we go through, your symptoms. We talk about your poop, obviously, your gut health. I go over supplements. I like to look at people's supplements and give my 2 cents. We go over meds. We go over past medical history. I like to look at labs if they've been done. Sleep, stress, diet. I try to get to know people as best as I can in an hour and a half. Right. And then we do some physical exams normally. I mean, now I meet people like this, and that's still happening. It's okay. It's just different. The only visits that are a little bit of a different style than that is when I meet with adolescents or teenagers. Then I'm usually meeting with the parent or guardian and the patient, and then parent or guardian leaves, and then patient and I just chat, and then we wrap up all together. Mm-hmm. But otherwise, that's pretty typical appointment. And I have sometimes that people want to do I don't need that long. Or I don't have that many complicated things. I just want to talk about this one thing. But the whole point of naturopathic medicine is that it's holistic. And so it's important to really hash out all those areas at the bottom of the pyramid and making sure that they're in place. And then I do like to do a lot of lab work, which really stinks for me right now because I'm not doing labs. Right.
And they're probably considered a non-essential, I would assume, too, if you even...
I mean, that's kind of a gray area, I would say. As a healthcare provider, there are some of my colleagues who are still seeing patients, and there's some of my colleagues in the cities who are still doing labs, but they have the correct amount of protocols and protective gear in place. I'm just not prepped for that. Yes. I don't have, my PPE is not stocked to the max. And so I wasn't able to do that. And, it's a little confusing to me even right now, what's happening in the medical system, even in our local area, in Mayo, at Winona Health, whatever, in terms of You know, do people go in to get their thyroid checked right now, or do they wait? How long do they wait? You know,
Right.
There's a lot of stuff we don't know.
Yeah, it's very, it's just that unknown right now, and what the next steps will be. So I think one thing you said, that you had talked about how some patient or some people come in and they're like, I don't need a full hour and a half. I only have this one issue. Well, we've kind of been taught that by Western medicine. You go in for one thing instead of, you go in and say, I have a sore throat. And they're like, well, let's just check you for strep and let's not check anything else, or as an example. So I love the approach that you take, because it really does get to that root cause instead of just putting the Band-Aid on top. It gets underneath it and fixes it.
For sure.
I love that. I love that.
Me too.
Yeah, all right. I'm sure that I'm not seeing any other questions pop through, but we are on a little bit of a delay. So if something pops through, if you guys have any questions for Dr. Ariel, go ahead and post them. For those listening later, you can certainly post them as well, and we will try and get back to you on those as well. Yeah, this was great. Anything else that you want to share?
Let's see. We talked about supporting the immune system. Oh, let's talk about what we kind of talked about before we started. So kind of the stress and anxiety piece.
Yes.
We were just talking about how I said some of my patients that I'm seeing right now are feeling, they're able to express to me like, oh, I'm feeling a little more anxious because, X, Y, and Z. And some of my other patients are just like, I'm feeling a little anxious, or I'm stressed, or I'm anxious, but I don't know why. Which is definitely I think there's a collective stress. There's a collective grief about all that's happening. And we're all being forced to really change how we do everything very suddenly, which is also super hard for me included. I think there's a handful of things that we can do to really help ourselves stay on top of that. And for some of my patients, over time, it's learning like, what are your stress management techniques, right? And are you utilizing them? And understanding that stress management isn't something that you do when you're stressed. It's something that you do regularly as a way to manage your stress on a daily basis. And right now, I think spending time outside is really essential and so good for us. I mean, if I am in a funk, one of the first questions my husband will ask me is, have you been outside today? So for me, I can know the effects that nature has on my system, but it does on all human body systems. And there's tons of research that back up exposure to nature, lowering blood pressure, and reducing stress, reducing ADD, and even promoting the healing process. Even in the Spanish flu, there's research that shows that, people who had a room with a window, or people who were even treated in a tent, had a better response rate than people who didn't have that exposure to the outdoors. And in this area, we're really lucky to be able to utilize it more so than really urban areas, which is a lot more complicated. And I would also express, use caution with your media, social media, and time spent reading about COVID. I've done this little baby experiments on myself where I don't look at my phone until noon. And wow, my mood turns out it's a whole bunch better on those days. So I think a lot of people are waking up and looking at their phone and reading all about COVID, what happened. And it's a kind of puts our body almost instantly into that fear-based position.
Yeah, I totally get that. And I think a morning routine is so important as well. just in
Yes.
general, to kind of have that same routine or something close to that same routine that you do, and
For sure.
build in maybe that, what is that one thing that you're going to do to take care of you, whether it's meditating or getting outside, or, I've had to learn to let go of like my morning routine not always looking the same, because one morning I might want to go outside, and one morning I might want to meditate, and one morning I just might want to lay in bed.
Yeah. Yeah.
Yeah, so I think that's important. But that's so true. I know for my own experiment, I guess, if I read about it, or if I hear the news right away in the morning, or I have somebody telling me, oh my God, did you hear about this? What does that do to your body? And what does that do to your immune system? So that is awesome. Yep, that is awesome. All
Hi,
right.
friends. I see some of my people saying hi. I have to say hi back.
Yes. We're glad you joined us. Yes. Awesome. Well, I'm glad you were on. Whoop, that's the sign that we are moving back. So when Sharon does this, then we get to dance a little bit. But thank you so much for being on tonight.
Yeah, thanks for having me.
You are welcome.
Awesome.
You are welcome. I'm sure we'll have you back again, because I'm sure there'll probably be more questions popping through afterwards. I think this was a lot of information and great information for people to take in and absorb. And if you want to get a hold of Dr. Ariel, what's the best way to get a hold of you?
There's multiple ways through my website. So if you go to rootedfamilymedicine.com, you can email us, you can call us, you can request an appointment time, which I'm doing all my new patient appointments in a format like so, and a lot of my follow-ups I'm doing over the phone, which is fine. But yeah, all kinds of ways on my website.
Awesome. And then, if you guys are listening later and you have a question, just pop it in and we'll hopefully be able to get back to you. So awesome. Great. Well, thank you. All right. So, and I don't see any last questions or anything popping through, just lots of love. I see lots of love for you popping through. I love this woman. Awesome. So, awesome. We'll have you on again. Stay tuned for Friday Night Happy Hour is our next Daily Daisy. So be sure to turn in for that at 7 o'clock. So, all right. Thank you, everyone. I'm sure Sharon will either pop back on or close us down, but I appreciate you being on tonight. And there she is. Hi. The woman behind the scenes. Awesome.
Thank you all for joining us, and thank you, Dr. Ariel. We appreciate you joining us, and it was such a pleasure to meet you.
Me too.
All right. Night, y'all. Have a good night.
Bye, everybody. Bye.